Let's tie up a few loose ends for myasthenia gravis. Now, the myasthenia gravis treatment, one of the treatment options, especially during a exacerbation, is the patient may undergo therapeutic plasma exchange. The procedure involves just like dialysis, so the patient will need an IV access. If they don't have a fistula, then it'll be a catheter, a central line, which will be used. Same central line used for dialysis. So I described this procedure to you last week. So just like dialysis, the patients will have 2 needles into their arm or 2 tubings into the dialysis catheter. And one tubing will remove the blood into the machine. And while in the machine, the patient's blood what will be removed here? So in dialysis, we removed what? Excess electrolytes, excess fluids, and waste products, right? So what do you think is removed here? Plasma is removed by the machine. And then the patient will be given either saline only or somebody else's plasma. Okay, so that's why we call it plasma exchange. So complications of, and this will be repeated. Okay, this is not one time. Is this a cure? No, this is only a temporary treatment. So as described here, there is expected temporary reduction in circulating autoantibodies. So this will be given, so this will last probably a few weeks, giving the patient symptom-free weeks. Okay, but again, there's no cure for myasthenia gravis. So either you stay with the medications or you can have plasma exchange, periodic plasma exchanges. So complications related to the procedure will be what? Since you're removing plasma, what could go wrong? Okay. So keep it within the within the contents of plasma. So what is plasma made of again? Water, protein. What else is in it? Antibodies and clotting factors. Okay, so there are others, but those 4. Let's just focus on those 4. As far as remembering what the possible complications are. So you're removing plasma. That's mostly water, correct? So what will happen to the blood pressure? It will drop the blood pressure. Same as dialysis actually, correct? Yeah. Hemodialysis causes the same thing. Because you're removing clotting factors, so what will also happen? Patients will have bleeding episodes. Because you're removing antibodies, does the machine only remove the bad autoantibodies? Or does it remove everything? Remove everything. Machine can't distinguish. Oh, I only need this. That one go. That one's good. No, there's no machine that can do that. So it'll either remove all or remove nothing at all. So it removes all the antibodies along with the plasma. So therefore, can this patient develop infections? Yes. Okay. So those are your complications. Most common. There are others. Of course, is the patient here at risk for toxicity as well? Citrate toxicity. Yes. Same as we described earlier with multiple blood transfusion reactions. What are those 2 electrolyte imbalances again? Calcium and potassium. Imbalances. What will happen to your potassium and calcium? Oh, the calcium gonna be very good, children. Okay. And we already discussed the surgical option last week. Any question on the blood transfusion procedure indications we discussed this morning? Very good, children.